Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 626,799 confirmed cases of COVID-19 in Canada and 200,626 cases in Ontario. Chatham-Kent has 816 cases and Sarnia-Lambton has reported 1,085 cases. Michigan now has 508,736 cases, with 26,364 cases being in Detroit. Today we are reporting 199 new cases of COVID-19 in Windsor and Essex County. 31 cases are related to outbreaks, 9 are close contacts of confirmed cases, and 159 cases are still being investigated. We have had 9,045 cases since March. 6,343 cases are now resolved and 2,512 cases are active. 86 confirmed cases are currently in the hospital and 16 people are in ICU. There are 174 suspect cases of COVID-19 in our hospitals. Today we are reporting an additional 3 deaths. 2 deaths have occurred in residents in long-term care and retirement homes. A woman in her 60s and a man in a woman in her 80s. Another death in the community is a man in his 90s. Our community has lost 190 people to COVID. 124 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 44 active outbreaks in Windsor and Essex County. 20 are in long-term care and retirement homes, 18 workplaces, 3 community outbreaks, and we have 3 hospital outbreaks. Vaccination of residents, staff, and essential caregivers of our long-term care homes continues. 3 more homes will be vaccinated today, bringing our total to 13 after today. We continue to work closely with all homes to get people vaccinated. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to your household members only. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. And cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Okay. Good morning, everyone, and thank you for joining us again. We've passed another milestone of reporting 9,000 cases in our community, and we continue to see deaths every day. And today, as we promised, that we will try to present some data on the school-age children, and we'll provide a recommendation when it comes to return to school for our most vulnerable in the population. So looking here at the epi curve, so this is for all population, overall how we have dealt with throughout this pandemic, and as we can see, we continue to see an increase in the number of cases quite at a drastic level in the last few weeks. And that number is not coming down at this time. So if you want to just focus on what's happening since September, we continue to see that we have seen a slight dip, but then we have started to see an increase in the number of daily reported cases as well, touching 200 cases based on the 7-day moving average. When it comes to the cumulative cases, we're seeing a sharp increase in the cases and counts. And so this particular graph looks at the flattening of the curve and seeing if we are bending it in any way. But what we have seen is we are seeing pretty much almost a very, very steep increase, hill that everyone is climbing right now with the large number of cases every day. And it almost looks like a wall at this time with the current case increase. So really this is something that we can look at in terms of the exponential increase that we are seeing in the community. So comparing our rates, that's one of the rates that the province used to compare different regions of Ontario by comparing with the per 100,000 population, a standardized rate with how we are doing. And what we can see here, right from the week of 18th, April 27th, all the way up to last week, our weekly case rate continues to climb. And since the beginning, we are now at 340.8 cases per 100,000 population. And just as in comparison, an area or jurisdiction goes into a red restriction level when it passes 40 cases per 100,000 population, and we are at 340 cases per 100,000 population. So comparing our case with the province and also with the southwestern Ontario, and as we can see, while the cases are increasing everywhere, our increase is significant and it's very steep compared to other regions as well as for the province. Looking at our overall regional and provincial rates, we now have the second highest rate in the province. We have surpassed Toronto and are only behind Peel at this time. When it comes to person positivity of our cases, our person positivity is right now the highest in the province, touching 12.3% of all the tests that are conducted in Windsor-Essex. Now, just focusing on the school-age children. So I showed you the picture of the epi curve by reported date with the general population, and now focusing specifically on the school-age population. And this is what it looks like since the beginning of this pandemic. So we have to recognize since the beginning of this pandemic, schools were closed. We have seen some surge around July time when we have seen a lot of cases in the school-age children, with a spike right before going into the Labor Day weekend. And then in September, October, our community did really well in terms of containing the cases. But then starting November, we started to see things change. We have seen an increase in the number of cases in our community as a result of some of the outbreaks. And then if we plot all of that in terms of when everything started. So at the opening of the school, we had a low number of cases, and then going into October, there was a switch in the learning models, and more schools switched to learning models and brought them back to in-person classes. And then at the same time, our community cases started to increase. We started to see an uptick in the number of cases, and then we ordered the local lockdown, and school closure began around December 11th. And since then, still we are seeing some increase in the number of cases in that population. So doing the same in terms of developing the cumulative cases, and we can see this is not very different than what we have seen for the entire population. So clearly, when we are looking at the school-age children, the number is the same, and the increase is the same. So they are not immune. They're not protected in any ways, and having that many cases in the school children definitely pose many challenges with the schools continuing to do with the in-person lesson. Looking at the exposure sources of school-age children right from the beginning in August all the way up to January, some of the key notables you can see is September, October. When our community cases were low, we have seen low number of cases, and most of these cases that we have seen in that school-age children were as a result of household contact, as you can see it in the yellow. But in November, when our cases continuing to increase, and just as an analogy, so if you want to look at October, roughly 10% of the cases that we reported in the month of October were in the school-age children were coming from outbreak source, as identifying as a source of cases were outbreak related. But then that changed in November. What we are seeing in November is we are seeing roughly around 35 to 40% of the cases coming from the outbreak with the high community transmission that we have seen in the region. And that's the same month when we reported one of the largest outbreak in our school, in our school area. Switching to December, when we switched to online learning, we have seen a significant surge in the number of cases in that month, but all of them were linked to household contact. But if we kept the schools open, you can imagine that if we go with the same numbers with what we have seen in November, how that would have impacted our school system. So now we're looking at the month of January. We still have many cases in the school-age children and that are still active, and there are many close contacts that are identified, which would be another concern if they start to go back to school at this time. Looking at the daily number of tests in the school-age children, so this is just a reflection of if there's any correlation in terms of the number of tests. Are we seeing more tests done in that population, or are we seeing less tests done? So what we are seeing right now, starting in the month of November and December, and even leading into January, there's lots of daily tests that are being done in that population, and as you know, the criteria for having those daily tests is someone to be symptomatic at this time, or they're identified as a close contact. So seeing that many children going for testing and approved for testing, it is something that we want to keep a close eye on to understand that if they are truly symptomatic or if there is any transmission that's happening in that age group. So looking at the person positivity in the school-age children, as we reported that our person positivity was 12.3% for our overall our community, but that person positivity rate is higher in that population group. And the highest person positivity that we are seeing in that age group is between the ages of 9 to 13. And at times, as you can see, it almost touched closer to 35% person positivity in that age group. And then the younger age group between 4 to 8, the person positivity was relatively low, but still above what we were seeing at the community level. The only difference that we can say when it comes to person positivity is most of these children, they are going to get the test done when they are symptomatic. For a lot of the other situations, such as the long-term care homes and retirement homes, some of them are mandated to get their testing done. So you can expect some implications of those surveillance testing in the overall person positivity. But still, if we are looking at just the difference in terms of who is coming back positive in that age group is important to consider as we make our decision to allow which students can safely return to school versus which we should still continue to switch to online learning. So looking at the emergency department visits and admission for respiratory fever, influenza-like illness among school-age children. So obviously this is not a true indicator of whether all of this are COVID, but this is an indicator of someone coming in to the emergency department and admission for the respiratory fever, influenza-like illness among that age group. And as we can see, since October, that rate was relatively low and contained, but starting in December, it really kicked off. And we can see that the admission has increased. We can see that the person positivity, the person of emergency department visit by the younger age group has increased significantly as well. So all of those are concerning trends for our community. So in summary, what we can say is our weekly case rate as a community is close to 340.8 per 100,000 population, and which is, I believe, is the highest in the province. Our person positivity is 12.3%. Our regional rate is second highest after Peel at 2,007 cases per 100,000 population. In September 7th, the opening date of our school, the 7-day moving average for COVID cases was roughly around 1. On December 11th, when we made the announcement to switch to online learning, our 7-day moving average was 9.3 at that time. As of January 5th, 2021, it is now at 15.1 cases per day. On December 11th, our cumulative case counts for school-age children since the beginning of the pandemic was 395. Between December 11th and January 5th, in less than a month, we accumulated 333 cases among school-age children. And at present, we have 33 active cases in the elementary school and 32 active cases in the secondary school, roughly, which would equate to 65 cases in our community that are currently active in the school-age children. But when you're talking about the close contacts for all these elementary and secondary students, we're talking around 500 students that are currently in self-isolation as a result of identified as a close contact. Based on all of that data, I am recommending to continue with the online learning at least until the end of the lockdown, which is January 23rd, 2021. We have shared our data with the ministry to help them understand the local situation. We are working with them closely to find the best way to keep our children safe by continuing online learning at least until January 23rd. Children with special needs can continue to attend school in person based on their unique challenges, and we must have to recognize that fine balance to understand their unique learning needs and the overall risk with the limited number of staff and students and staff in the building. Schools can remain open for the provision of full-time childcare services. While it is general recommendation for all workplaces to work from home, the educators and staff can attend school for the purpose of conducting remote learning. And while attending or to attend meetings with the school officials and to manage facilities with continuing to follow all the infection prevention and control guidelines that have been already identified by the Ministry of Education as well as from the health unit. While there is no doubt in my mind or in any of my team's mind that in-person learning is critical for the developing minds, but we cannot jeopardize the safety of our children given what the data we are seeing in our community. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, yes, good morning. I'm wondering, when do you expect we'll know from the ministry whether or not they'll be taking your recommendation and making a decision on that? When will we hear from them?
So that conversation has been ongoing. We have had a number of calls, emails, exchanges, expressing our concerns and looking for some directions. We are hoping that there may be some central direction that comes in, because I can only speak from my area. I don't know what's happening in other regions and what the flavor is in terms of the willingness of other medical officers of health, as well as the overall picture from the provincial perspective. If a central decision or direction comes in, we will welcome it. But in case if this is an isolated problem, which I'm not sure that it is, but if it's an isolated problem for our community, I will be moving forward with issuing the order tomorrow. But I'm waiting for the province to maybe look at all the data from every region in the province and make that decision. But if it comes to that, to make that local recommendation, I've already made that, and I will move forward with the issuance of an order if needed. So bottom line is, from Monday, whether the province do it or whether I do it, it will be an online learning model for our community.
Okay, thank you. I'm just going to shift to another subject. Can you please talk about the local vaccination task force and what came out of the meeting on Tuesday, including what directives you were reportedly given by Strategic Military Planner Andrew Stewart?
Well, while I don't want to speak specifically about any individual who said what, all I can tell you is there are, and again, this is one thing that really is concerning, that when people are talking about their own perspective, their own understanding of the problem, and their own views of how to solve the problem. Public health have been dealing with mass immunization every year. We deliver, distribute, administer vaccine for influenza, more than 120,000 doses every year. So this is just to give you a perspective. This is based on our regular routine operation. This is not something that we do in any emergency situation. In addition, we are also responsible for the delivery and of all the other publicly funded vaccine to our community, which would be in thousands and thousands of doses. And on top of that, our nurses directly administer the school-based vaccination, which could be range between 13,000 to 15,000 doses every year. So this is not the first time that we are talking about this mass vaccination. We recognize the urgency of the situation, and that's what you have seen. The moment we got the vaccine here, we were on it, and the province has given us a timeline up to January 25th. And we are on track to finish all the vaccination, either, like, and I don't want to give you a specific date, but we will finish everything even before, like much before than what is tasked by the province. So I recognize, I understand that there is this sense of urgency, but we also have to recognize that we are not getting any vaccine, any additional vaccine that we have right now, even before February. And we are not getting any, the hospital is not getting any additional doses of Pfizer other than to give the second dose to everyone who has received their first vaccine. So that's the reality. We can talk about all about it, that this is the sense of urgency, that we have to do it right now. We're also in the middle of the pandemic, and we are doing that. So not to undermine the importance of having those plans in place, but I can assure you that there is this conversation that we are having every day. I was on a call with the General Hillier last night, with the Premier, with the Minister of Health, with Solicitor General, with many other deputy ministers, and we had that discussion. We talked about it, that what's happening in Windsor-Essex, and I really love the opportunity to speak directly to the people, and I shared our data, and they were really impressed with the timing and the urgency of how we mobilized our vaccines and how quickly we got it into the arms of all the vulnerable population in our region. We've already passed more than 50% of the homes that are in our region, and we will be on track to finish it all. So I think, yes, there is a task force. Yes, there is that planning need and the urgency, but I think this is causing more panic and concern in the community, and especially if any of our leaders in the community are saying things that they don't know what is happening. This caused confusion, and this is not leadership, sorry. This is absolutely not leadership. A leader's job is to give comfort, reassurance to the community in this time of crisis. And if any leader is saying that, I'm sorry to say, this is not right thing, and this is not how leaders lead. Leaders' job is to communicate and give a sense of reassurance to the community, and to provide support, and to do what their role is to the frontline people who are in the middle of everything. So that's all I can say at this time. And I'll finish off on the note to say that we have a good structure and system in place and we are talking every day with the ministry, and we know what is in sight, what to expect, and when to mobilize which option. We will be working with each and every community partner. I can assure you, this is not a task that I am willing to take on my own, or as a health unit we are willing to take on our own. We will work with each and every possible partners to get the vaccine into the arm as soon as possible, as soon as we have all those details that we need to work on, and then we need to have a plan in place. There is no doubt about it. You will see, we will share our high-level plan shortly, but again, we're also still in the middle of the pandemic. We talked to you about the data, we talked to you about the concerns of the school. Is this important, or should we be talking about this, the thing that we have to expect in April and March? Is it important that we should talk about how do we vaccinate in April versus you have 3 hospitals out in outbreak? You have your healthcare system right now is on the verge of collapsing. Is this the thing that the priority that we as a community are thinking about? So I'm sorry, this is just a distraction by some people to think that this is the priority about the vaccination. No, it's not. Think about the lives getting lost every day. Think about everything else that is happening. Vaccines, the moment it come here, you will see that how quickly it will be mobilized and how quickly it will get into the arms of the people.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. Just to clarify, so you're making the recommendation to Ministry of Education to keep schools closed, but if it doesn't come from them, you will put the order in yourself?
That is correct, yes.
Okay. And sorry, I had another one. It's completely lost me. Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, will in-school learning resume for children with special needs early, like you mentioned, even if the lockdown is extended?
So children with special needs are already in the school this week, so they will continue as it is, recognizing that their unique learning needs, and also when we are truly talking about the risk, the number of these special needs students is far less than when we're talking about having everyone in the class. So finding that right balance, we feel that if the school boards have the ability to continue with the ongoing special needs education as per the Ministry of Education direction, they can continue to do that, and they just have to ensure that they are following all the guidance from the Ministry of Education as well as from the local health unit.
And you spoke about how many school-age children have active cases of COVID-19 right now. Can you speak about how many more cases that could have led to if they happen to be in school learning right now?
Well, I guess, again, we can only go with making certain assumptions based on the model that we have right now. So if in the last month we have seen 333 cases, would the cases continue to increase? So if we use the same analogy and with the current increase, and even if we go on with the holding pattern, we can anticipate that January, the month of January, we are looking at between 350 cases to 400 cases among the school-age children. So, and again, if things get worse, if any of these children, if they go back to school and if it leads to an outbreak, then we're talking about an exponential increase again. And most of these children, as we know, that maybe their symptoms are not that severe. They don't get sick like the elderly people. So they may be there without even realizing that they are spreading it. And we know, I have children too. They do not physically distance as much as we like them to do. They do not adhere to the mask as much as we like them to do. So we know all of that. If your community case rates and if your person positivity of the community is so high, the likelihood of having an outbreak in the school setting is really high.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, just going back to Maureen's question, just for clarification, so there's no confusion out there. So no matter what, this coming Monday, students will be continuing online learning.
That is correct, yes. So we hope that if a provincial direction comes in, that will be across the province. But if not, locally, my recommendation will stay. So it doesn't matter. Windsor-Essex students and anyone who's going to this school in Windsor-Essex, we are asking them to switch to online learning until at least January 23rd. At that time or before that time, we will look into our data again and then to make another informed decision. But at this time, what we are seeing is not giving us the comfort to say that it's okay to continue on with the in-person learning at this time.
Any idea when you think you'll hear back from the province? Is the Premier and the Minister supposed to make an announcement today, or this will be a direct one-on-one conversation with our local health unit?
Well, I expect that there may be some conversation about it today. I cannot guarantee. Obviously, the ministry works and the Premier and the Prime Ministers, they have their own priorities. But I do expect that they may come out with something, either yay or nay, today. And that would allow us to make it more formal tomorrow by issuing an order if it needs to, If it's a direction that's coming from the province, then it would save us from that effort.
Okay, and a couple questions for Teresa. Teresa, yesterday we reported, and other media outlets reported, PR rep at Erie Shores received a vaccine. Can you tell us if yourself, Dr. Ahmed, or any of your leadership team has received the vaccine?
No, we haven't.
So when you hear a PR rep has received the vaccine and others out in the community, such as doctors, some of your members, nurses, PSWs, are you disappointed, or what? Just something doesn't add up here.
So I can say that Dr. Ahmed and myself, we had such an in-depth discussion about our nurses that are actually vaccinating in the long-term care homes. So vaccinating the vaccinators, which are our nurses, are going into these homes that some of them are in outbreak, some are not. But actually, so our conversation regarding vaccinating our vaccinators was very in-depth. We, at our health unit, make very responsible decisions with the vaccine. And the direction from the ministry to us has been residents, essential caregivers, and staff. And we even consulted with them about the ability to vaccinate our vaccinators, which they supported. I'll let Dr. Ahmed comment, but we know this is a very important vaccine, and we know that there are priority populations that need to get the vaccine.
So Rob, in addition to what Teresa said, there are very strict ethical guidelines as well as some clear guidelines in terms of which healthcare worker we're talking about. It's not even about all healthcare worker. There is a risk prioritization matrix that everyone have to complete in terms of identifying what the potential risk of acquiring the disease, and then factored in with what is the risk of developing more severe outcome of the disease. So there is a scoring system that has to be adopted to get to the point to say that, yep, you meet that requirement. It's not about even just being a healthcare worker. And so far, the priority that you can see is like black and white is long-term care home, retirement home, healthcare workers, you are getting vaccinated, period. There's nothing else that we need you to do. But when it comes to even the hospital-based worker, who are they working with? What's the risk of acquiring, and what's the risk of developing any consequences? I can say that, yeah, I work with patients, but that doesn't even mean that your risk of acquisition is high. That doesn't mean that your risk of developing severe consequences is high. So if we go with that analogy, you have got thousands and thousands of healthcare workers who are working with the patients every day. So that's not a justification. So I think the institutions, we should take that responsibility very seriously and to prioritize their healthcare worker based on the ministry identified criteria, not just because they are interacting with people. And I can, and I'm sure, many of our team members can be on record to say, yeah, we will probably be in the least of the priorities before we prioritize all the important people in our community. My seniors, those are the most important priority in my mind at this time. As soon as I'm done with the priorities that are identified by the ministry in protecting our vulnerable in the long-term care home and retirement home, my immediate priority in the community is our seniors, even before then what I can think about the healthcare workers. So again, there are some provincial direction, there are some ethical framework, and there are some things that we as individuals need to understand, that what makes you get the vaccine, especially if it's such precious with limited supply, and we want to make sure that every vaccine is going into the right people to provide that protection. So I really feel that everyone who is sending those names forward for booking, they should really look at that and question everything before all these vaccines are given to people who shouldn't get in the first place.
No, just at that point, sorry, one more quick question here. Is there, and I'm not trying to make a joke, but is there a master copy in Windsor-Essex on who's getting the vaccine?
Well, the province have a database that they are managing, and they expect that all that information to be inputted on a real-time basis for when someone is getting the vaccine. At some point, public health will have access to it, but obviously right now, the sites that are administering the vaccine, they are inputting that data at this time.
Thank you.
Any questions from CTV?
Yes, good morning. Can you talk about how difficult this decision must have been to continue the remote learning until January 23rd? There's a lot of parents and students that have opinions on both sides of it. So how difficult was it for you to make that decision?
Well, and as I've always said, that I am also a resident of this community. I'm also a father. I have my children going into the school as well. I get to hear from them too, what they like, what they don't like too. And I can tell you, like, children are different. Everyone's learning need is different. I've got two boys who are going to school right now. One is fine with continuing on with the online. The other one is not fine with continuing with the online learning. So I can imagine the challenges every parent has to face when making this decision on their own. But looking at what we are seeing right now, the data, and I think that's where I tend to make my decision focused on the public health evidence, public health impact of this evidence, and this is exactly what I have done. It was not an easy decision, I can tell you. My guiding light is always the best interest of the public, best interest based from a public health perspective, and we'll continue to do that. Doesn't matter how difficult this decision is.
Okay, thank you.
Any further questions from CBC?
Hi, yes, I have a follow-up question about who should be getting the vaccine and who shouldn't. We know that administrators at long-term care homes have received the shot. So can you sort of explain the decisions there, like why an administrator at a long-term care home might receive it before a resident? Can you just talk about those decisions?
So I think in terms of sub-prioritization between a long-term care home and resident, there is none. So I think it's just because it's just a matter of who's ready to get the vaccine in the long-term care home and retirement home. And the rationale for even the administrative staff and not to make that distinction between the direct care worker versus the admin staff is based on the availability of the vaccine and their likelihood of them in that environment, which all of these people are. We know that in closed environment, there are more chances of the disease spread. So even when we are talking about the administrative staff, at some point, they're having that kind of shared breathing space with many of their coworkers, with many of the residents. So I don't see them very much different than the actual healthcare worker who are having physical contact, direct contact with the resident. So everyone in that home, they should be protected. Anyone going in to that room, to that home on a regular basis, those should also be a priority because we definitely don't want to introduce any new case or anyone bringing in COVID into that home. So anyone in that home, we're looking at and identifying all that group and trying to get them vaccinated.
Okay, so you're saying that we don't need to make a distinction among staff at long-term care, but there should be distinctions, separations made among staff who work at a hospital, for example. So not everybody at a hospital needs a vaccine right now, is what you're saying? At
this time, yes, because we have limited supply. And again, we know that once COVID gets into a long-term care home and retirement home, it'll be bad, people will die. That may not necessarily be the same for the healthcare workers in the hospitals. Yes, their risk of acquiring the disease may be high, but given what the numbers that we are seeing right now or the doses on hand we have, They're not identified as a priority at this time, and we'll continue to look for more vaccine, more direction on vaccinating. I want to vaccinate them, don't get me wrong here. I want to get all our healthcare workers, because they are at the front line, they need to get vaccinated. But when we have limited number of vaccine, there is a prioritization that's given out to us by a National Advisory Committee on Immunization, and that guidance is further clarified and refined by the province. And then again, at our level, at our local level, that guidance needs to be further clarified in terms of who and when, and all of that work is happening right now.
And just one last question. You mentioned during my first question earlier that you'll be sharing a high-level plan shortly, and that was in response to my vaccine question. So can we expect, is that a plan around what mass vaccination will look like in Windsor-Essex once we do have more shots locally?
Well, that would, again, what we would talk about the different modes, different modalities of how the vaccination will occur, what kind of or how many of these mass vaccination clinics we need, how many modalities of mobile clinics we need, what kind of other outreach that we need to meet based on the various health sector partners. Like there are home care support, there are CHC, there are other healthcare providers who are going into various high-risk population. What does that look like? What is the need? What's the data? How much? What's the number we are talking about? How many seniors we are talking about in terms of who are 90 plus or 80 plus or 75 plus? Where do they live? How do we approach them? How do we target them? So there are all of those lists. It's not just about numbers. We cannot say, yeah, we need to vaccinate 3,000 people every day. Sure, if we are just going with that formula, then I can set up a clinic right now today and get all those 3,000 people, walk around in various parts of the community and get it done. But we need to have some of those background pre-work before we even talk about how do you implement this vaccination clinic. Implementing a vaccination clinic, setting up a vaccination clinic, it's easy, it's simple. It doesn't require a lot. It does require a little bit of background, all of that work, and that's the work that we need to figure out as the task force. We need to get all those resources, all those key players in there to build that plan. Even if you're a city, let's say, for example, you were as Katarina, you work for CBC, and if you want to say, hey, we want to help you, I will tell you, okay, CBC, tell me, if we give you the vaccine, or if you have the vaccine, how would you implement it in your staffing? What do you see for your own team? How should they get vaccinated? Tell me, give us a plan. So if you are a large employer, if you are other service providers, you can think about that. You can think about how my staff they will get vaccinated and get that work done, because I don't know. I cannot plan that part for you. I can plan it for the masses, but there are different pieces of the planning that needs to happen. We have a large number of students at University of Windsor. We have a large number of students at St. Clair College. How can they set up their system or immunization services to cover their staff, their students? There are so many other pieces. So I think getting down to the operation of it, it's manageable. And it can be set up very quickly. I think some of these work, the modalities, given what we need to do, is critical piece. And as I said, this is not the first time that the health unit is administering all these vaccines. We do that every year, at least for 150,000 population every year, if not more. But that's what we are doing, and that's why we are having those direct conversation with the ministry every day. And if they ask us to, go do it, we'll do it. So I think it's just the urgency and the confusion that is being created right now in terms of the timing of it. That's inaccurate, and it doesn't solve anything. It just slows us down. It just makes me explain all of this thing to you while I can be spending my time and thinking about some other priorities that is currently we are facing right now.
Okay, so just to clarify, there is a plan that you are going to be unveiling as you are getting, that background data in place?
Yes, absolutely, yes.
Okay, and when can we expect that?
You can expect that before the end of this month or maybe sooner. So some of that work is already ongoing, and some of that structure and guidance is coming from the province. So you will see all of those details in place before the end of this month. And I can assure you that there is no indication at this time from the ministry that we are getting vaccines in such large doses to change our plan even before April, March or April we are talking about. So you will have all of those planning pieces in place by the end of this month, and then we can operationalize all of the additional details of and actual logistics of all of these clinics probably next month. And then even if we are lucky and if we get all of these additional doses starting in March, we'll have the system in place. But so far, what we know based on the federal allocation of the vaccine, based on the provincial forecast and projection, nothing is coming for mass vaccination before April.
Okay, thank you.
Any further questions from Blackbird?
Yes, sorry, thank you. What indicators would you like to see or would need to be in place before you would recommend the reopening of schools?
Well, as I said, there is no clear formula that I can tell you at this time that would help us. I think I would like to see the community cases going down. I would like to see the school-age children, their cases go down as well. We anticipate that a lot of the cases that we are seeing is because of all this holiday season and people still meeting their family members. So hopefully that number should start to go down, and by the end of the lockdown in January 23rd, if we have all the right indication, we would definitely support the decision to open the school. So even if I write my order, it will be at least until January 23rd. So January 23rd, it will expire, and unless we issue another order. So we'll work with that timeline, and I hope that this would give parents some sense of planning, that what they need to plan in terms of their childcare needs and any other arrangement that they have to make. And we'll try to be diligent in communicating the next set of instructions when we get to that point.
Okay, thank you.
Any further questions from the Windsor Star?
Yeah, Teresa, you mentioned vaccinating the vaccinators at the health unit and that the province had given you the green light to do that. So for clarification, did the vaccinators receive the vaccine?
So what we're doing as we go out into the homes, we're waiting till everyone's vaccinated. And if there is vaccine available for our nurses, we're using that so as not to open a new vial. So I believe that some of the nurses have been vaccinated, not everyone. So as they go into the homes and there's the availability after the home is all taken care of, a few nurses will be vaccinated, and we are staggering it to make sure that that we're not vaccinating everyone together, but in case they do have side effects but anyhow, yeah, so not everyone's vaccinated, but we're in small increments. They will get vaccinated.
Okay, thank you.
Any further questions from AMA 100?
Dr. Ahmed, just going back to the school, so is it safe to say the next update would be in and around January 20th and 21st from you?
Yeah, that would be fair to say.
Thank you.
Any further questions from CTV?
No, thank you.
Okay, thank you, everyone.